class, my name is Claudia Rivas and I will be doing the demonstrative video on how to properly care for a wound at home. This class is for the oral communication and it's for Professor James Capurso. I'm going to go ahead and start off by the supplies or materials needed to care for your wound at home. And these are materials I have gathered together. These are just some of my good materials that I like to use, but you can pretty much use whatever you have at home, or you can also go out and purchase at any local pharmacy. And we're gonna go ahead and get started. I'll show you guys what we need. We're gonna be needing some gauze. This is 4x4 gauze and some rolled gauze, which this is Curlex, an abdominal pad, which looks like this. I'm going to also need my gloves. These are a must, or if you don't have any gloves at home, just washing your hands really well, soap and water, that'll do. I do have my betadine ointment here. This is gonna be taking care of the wound. And then I do have my antibiotic medication already in a medicine cup. You can also just get another medicine cup if needed. I do have my 3 different tapes. These tapes are just depending on where you're going to be placing or rolling the gauze, if on the skin or just directly on the gauze. I do have my tongue depressor here, my Q-tips here, my pre-filled syringe of saline. This is just salt water. I do have a bandage. This is just a bordered foam bandage, and I do have different other ones that you guys can also use. Doesn't have to necessarily be this brand, but this is just suggestions. I have Coban. This is just to keep everything together and just compressing the wound for no bleeding. This is another type of compression. This is more cotton material, so these are some ACE bandages. I do have my checks that we will be needing, and I also have just a linen tray just so we can keep everything sterile on there. I do have some knitting that I'll show you guys what we'll be using that for. And lastly, I do have a towel, and this towel is just for traumatic wounds, heavier drainage, so we can go ahead and just clean it nicer with that. So let's go ahead and get started. I am going to present to you guys my model for today, and my model is Kaylanie Lopez.
Go.
Kaylanie, right here. And the wound we're going to be taking care of today is on her forearm, and this is the wound, how it looks like. I already have everything set up here that we will be needing. Just have her place her on there. I already washed my hands, soap and water. I'm going to be putting on my gloves. So for this wound, it's a traumatic wound, meaning she either fell down or something hit her. So we're going to want to go ahead and start off by rinsing it with saline. And as you guys may see here, I already have some pre-done stuff. This is just betadine gauze, a Q-tip, and a tongue depressor. And I will be needing my saline and my gauze. This is just 4x4 gauze. We're going to start off by rinsing the wound. And you just want to go ahead and just pat it dry. Don't care for removing any type of stuff. You don't want to cause the wound to get any bigger or anything. So just pat it dry. Then we're going to go ahead and grab our betadine. This betadine, we're just going to swab it on the outer corner of the wound. I am going to want to use my antibiotic ointment that I told you guys can use. This antibiotic ointment, you're going to want to go ahead and place it right inside the wound. This is just to prevent for any infection. And if it comes out like this, it's okay. But I want to go ahead and just clear that up. Next, we're going to want to go ahead and just cover our wound. So this is just a traditional covering that we normally do, and it's basically gauze and rolled Kerlix. I forgot to mention that you're also going to want to need a good pair of scissors. And your good pair of scissors is always going to want to be a bandage scissors for any type of wound. I'm going to be cutting this, placing some tape. And lastly, you're going to want to use your netting. This netting will help keep everything in place and prevent any type of wound or any type of infections going inside your wound. You may also use your ace bandages. This is to prevent any bleeding. If you do have heavy bleeding, you're gonna wanna go ahead and put pressure on your wound and to keep it from the bleeding. And this is just the ace bandage, which will go something like this. She does have really skinny arms and she's a younger child. So it's, you know, it's just more bulkier, you can say. But anything will do. And that is how you properly care for a wound at home. I hope you guys enjoyed my video. And if you guys have any suggestions of how I could have improved, I would love to hear them. Thank you.